Good morning, students. That time again. Chapter 30, Substance Abuse or Substance Use Disorders. Okay, so what is a substance use disorder? Well, basically, it's an umbrella term for substance abuse and substance dependence. Okay, and we're going to look at both of these terms in a minute. Substance abuse is repeated use and or abuse of a substance, alcohol or drugs, which leads to dysfunctional problems. Okay? And a substance dependence is when you continually abuse or use a drug or a substance, even though you know that there's negative consequences to that abuse or use. An addiction is a compulsive involvement with alcohol or drugs, even though you know that you have negative consequences and you are abusing those drugs. Okay, and there's a high tendency for relapse. That means that you relapse and you start using again if you're addicted to a certain drug. Tolerance is when your body becomes used to, all right, that drug or that alcohol, to the point where you need higher and higher doses just to get you to that previous state of either euphoria or stupor that you were in. Okay, so your body just gets less responsive to the drugs or alcohol, or desensitizes itself. Withdrawal symptoms. What are withdrawals? Those are painful symptoms that follow the discontinuation of any type of drug or alcohol. Okay. Nearly 52% of Americans 12 years or older report drinking, and 21.8 million Americans 12 years or older, 9% of the population, are currently using illicit drugs. Alcohol abuse statistics. Okay, alcohol abuse increased from 3.03% to 4.65% from 1992 to 2002. Look at these statistics. There's a lot of information there. It shows you the intensity or the degree to which alcohol has increased. We also know that non-medical use of prescription drugs like opioids and other benzodiazepines, etc., has increased considerably in the years. There was recently there was an opioid epidemic. Too many opioids were being prescribed. People were dying from opioid abuse. More than 1 million visits to the emergency room are drug related. Okay, every year. All right, so a lot of drugs are abused. What are we talking about? We're talking about cocaine, prescription opioids, ecstasy, methamphetamine. All these are like the primo drugs that people love to abuse in the U.S. Okay. All right, so let's move forward. Factors influencing substance abuse: age, sex, and ethnicity. Sometimes we see the younger population really getting into experimenting with drugs. More males experiment than females. Ethnicity depends on the drug of choice. I think statistics show that whites like to drink alcohol more than use drugs, where the heroin and benzos they seem to be fall more with the Latinos and the blacks using more. Uh, and depending on your social setting, if you use it socially or not, availability of drugs, some areas you can't get certain drugs, so it's not used as much. The cost, certain areas they might charge more for it, so these individuals won't use the drugs as much. Peer pressure also has a lot to do with it, with whether it's a key factor, whether people use it or not. Okay, but regardless of the patient's substance abuse disorders does cause physical impairment and social impairment and psychological impairment at some time during the abuse cycle. So it's a problem. Factors influencing responses to drugs. Of course, the dosage. If you take a big dose, you're going to respond more. If you take more of the drug frequently, so frequency is an issue. It's going to be you're going to respond to it more. And the route, for example, oral route, less effective than IM, intramuscular, or intravenous, or intrarectal. There was a story of a gentleman who had cancer of the esophagus, and he wanted to drink. He was an alcoholic, and he couldn't take it in through his esophagus, so he had his wife give him an enema, alcohol enema. And so you could take alcohol or other substances per rectal, and they will have they will be equally effective. Okay, individual factors, biologic, your makeup, your body makeup, that'll influence your response to it. If you're big and you carry a lot of adipose tissue, you're big and tall, you'll respond to the dose a little bit less. You have less responsiveness to the dose than someone who's average. And then there are behavioral, social, and psychological factors. Alcohol-related disorders. Let's look at the alcohol, the term, aka ethanol, and abbreviated ETOH. So you'll see that in the medical charts, ETOH. It's basically a depressant. Even though people get disinhibited, they feel kind of a little bit euphoric, but it depresses the nervous system and disinhibits you, but depresses the central nervous system. So it depresses CNS and it depresses the respiratory system. And it has mind and mood altering effects. Let's look at the term proof. You say, sometimes it says it's 50 proof, it's 100 proof. So what does it mean when you say 100 proof? When you say 100 proof, what you're saying is that there's 50% alcohol in that bottle of alcohol. Whatever that is, it's 100 proof, 50% alcohol. In order for it to have 100% alcohol, it would have to be 200 proof. Then it would have 100% alcohol. Okay, now 200 proof is not illegal to sell 200 proof to consumers. This is only used, 200 proof is used in labs for laboratory reasons. So you drink 200 proof, you might kill yourself. Okay, but nevertheless, 200 proof is the highest, or 100% alcohol is the highest that one could go. So that's basically the ethanol or alcohol concentration. Alcohol abuse patterns. Basically, as we said before, alcohol is a sedative. It impairs mental functioning and motor functioning. After a while, you start becoming ataxic. It can create a stupor. You get into, you just like, you zonk out. uh, and it can also stop pain, stop you from feeling pain, so it could stop pain receptors from responding, and eventually coma, and eventually death from respiratory and circulatory collapse. When I was in respiratory therapy school, I knew a professor. One of my professors said that one day he was with his friends and they were on campus and they were drinking vodka. And they drank so much vodka that he went out into the street and he fell out on the lawn, and there was snow on the lawn, and then it started snowing some more, and all he had was a shirt and a pair of pants on, and he fell out on the lawn. Everybody was in a stupor. They just fell out drunk, and he woke up in the morning and he was okay, because the alcohol, he had drank so much vodka alcohol that it was saturated his blood and his tissues, and so kept him warm, and he couldn't freeze. He didn't freeze to death. Factors of affecting alcohol concentration in the blood is of course, the absorption rate, how fast it is absorbed. So if you eat food, you will decrease the absorption rate. Okay. Generally, it's preferred that you do eat while you're drinking, in order to slow it down. And how fast does it distribute to the different body parts? That depends, of course, on your metabolism and elimination. Is your liver able to break it down and get it to where it needs to go? And are you able to eliminate that alcohol, get it out of your body? Okay, so all these are factors that affect the alcohol concentration. Let's talk about DUI. DUI is driving under the influence, and is defined as a blood alcohol level of 0.08 or above. Now, how many drinks do you think an average person would need to get to a blood level of 0.08? Right, about 3 drinks. 3 drinks or 3 beers to get to that level. Depending now, in 1 hour, right, in that time frame, and did that person eat? Did they have something to eat, or they didn't eat? Okay, so, and of course, that's an average person, maybe weighing 160, 175, and etc. So if they didn't eat, a lot might be a lot higher, but 0.08 is that's the magic number for DUI. Now, as a professional, you need to be careful, because this could be 0.08, and getting arrested DUI could be life-changing. Okay, why? Because certain states have zero tolerance for DUIs, and your license might be in jeopardy. All right, let's look at blackouts. Effects of heavy alcohol use. Blackouts. All right, so a blackout is basically you are drinking, and the next day you don't remember anything that happened, or you don't remember stuff that happened the day before. All you remember was that you started drinking, and then that was it. Okay? You don't remember passing out. You don't remember fainting or losing consciousness, but you just can't really remember the day prior. Maybe you didn't pass out, you didn't blank out, you didn't lose consciousness. You just drank, and then finally you said, I'm going to bed, and you went to bed, and now you don't remember anything from the day prior. That's called a blackout. Intoxication is when you drink so much, you keep drinking, and then your behavior becomes maladaptive. You start acting a certain way. You put a lampshade over your head. You start stripping your clothes, and you take your bra off, and you flinging it around, and who knows? You do crazy things. Tolerance, as we mentioned before, is when after heavy drinking, your body just becomes physically adapted to the alcohol levels. Um, you know, well, going back to intoxication, let me not forget that those type of maladaptive behaviors could be you impaired judgment. You know, maybe you'll go and you sleep with your your girlfriend's boyfriend or someone. You start fighting or arguing with people. Your speech gets slurred. Your gait is unsteady, and you're not coordinated. Uh, Usually, intoxication. After a certain amount of intoxications, you're gonna impair your occupational, social, and relationships. There's gonna be problems there. All right, let's talk about withdrawal. Effects of heavy alcohol use can lead to, after a while, that individual just, if you stop drinking all of a sudden, he says, I'm going to just, that's it, I'm going to stop drinking. Next thing you know, that person will see an increase in blood pressure, heart rate, anxiety, tremors. They'll start sweating, they'll get irritable, may have insomnia, and they may even have hallucinations from not drinking. These people have been drinking for a while. They can't just stop drinking like that. Usually what we do is we'll put them on a Librium taper. Means taper. You taper them off slowly. You start maybe a 3 to 5 day taper. Every day you give them a little less, okay? And for maybe a week, 5 days, 3 days, 5 days. You do a Librium taper or an Ativan taper where you will taper them off, okay? So this is to prevent them from going through withdrawals. Delirium tremors. That's usually within like 24 hours, you're going to see withdrawal symptoms kicking in. And delirium tremors, usually within 48 hours, these people are going to become very agitated, confused. They're going to may have fever, increased blood pressure, and pulse. So delirium tremors are worse, and you have to look out for them within 48 hours. Okay, physical complications. What happens after this individual has been drinking for so many years, etc., of abuse with the alcohol? Liver problems. You might have cirrhosis of the liver. The pancreas starts to get shot because that pancreas has to break down the carbohydrates which are found in the beer and the alcohol. And then there is also CNS disturbances, because remember that alcohol causes is toxic. Alcohol is a toxic substance, and that continuous bombarding of the brain cells with that alcohol eventually just starts destroying brain cells. So what we're going to see is Wernicke's, which is a ocular disturbance when can lead to dementia. Remember, we talked about Wernicke's, Korsakoff syndrome in dementia, and ataxia, which is an unsteady gait. Usually the way that we treat Wernicke's is with thiamine, which is vitamin B1. We could treat it with that. And we also have Korsakoff syndrome, which is short-term memory loss, also with gait disturbances. So what happens there is that these individuals have trouble forming new memories, okay? And that is what we see with that. Let's see. Let's move forward. I think I've covered everything there. Drugs. Let's look at what kind of drugs are abused most likely. We have stimulants. What do stimulants do? Well, stimulants increase energy. They increase alertness. And you have Adderall, which is used, amphetamines, which are used by students when they have long periods that they need to study for and stay awake for. It increases energy and alertness, and it elevates the mood, but it also can make you irritable and anxious. So, amphetamines, methamphetamines, ecstasy, cocaine, these are all used by the populace. We know that ecstasy is used by a lot of young people. It's a club drug. They use it in when they go to clubs, and increases, heightens sexual desire, etc. Cannabis is marijuana or hashish, orally ingested or it's smoked, and it induces relaxation, pleasure, and it distorts space and time, and it also gives you the munchies or makes you hungry. Hallucinogens, we're talking about LSD, PCP, phencyclidine. These are mushrooms, peyote, also. Euphoria, they cause euphoria and an alteration in perception, memory, and judgment. And patients usually present to the OR in a dissociative state. They're kind of like zoned out. They're almost like they're not here. Where are they? We don't know. Okay? Opioids, which have been used for centuries as a pain reliever, as we mentioned before, we've recently had opioid epidemic, or rather a pandemic, opioid pandemic, where opioids were used, prescription opioids especially, too many doctors writing prescriptions for opioids. Heroin, morphine, codeine, all these are opioids. Narcan is the drug of choice for reversing opioid intoxication or overdose. Now I believe you can go and get Narcan in the pharmacy over the counter. All you have to ask for is the Narcan. It's an injectable form. Also used by the populace are sedatives, hypnotics, and anxiolytics. We know that anxiolytics are what? Benzodiazepines, correct? Ativan, Klonopin, all these, barbiturates, okay? These are used to treat anxiety disorders and to facilitate sleep, relaxation. However, they impair judgment and the behaviors, they disinhibit like alcohol does, so the behaviors will be similar to alcohol intoxication. Rohypnol and gamma hydroxybutyrate, GHB, are date rape drugs. These are used to rape women. You men or women, you spill a little bit into a drink, and that person won't remember what happened, and they won't remember the next day. Okay? Withdrawals from opioids, let's go back a little bit. Withdrawal from opioids can be very severe. You could have some really severe cramping, tremors, panic, and chills. These people, it's a very, very uncomfortable feeling, and what we usually use is we can give these patients, we'll give them Suboxone and or methadone to withdraw from for the withdrawal symptoms of opioids. There's also benzodiazepines and barbiturates. All right, we know that these lead to a sensory alteration, and they can really calm a person down. But we need to remember with barbiturates and benzodiazepines that if you stop taking them, all of a sudden you can have withdrawals. We know that benzos and benzos specifically, they increase the seizure threshold, as do barbiturates. So they increase the seizure threshold. So if you stop taking them, the seizure threshold drops and the seizure can get right in. Okay? Common psychiatric illnesses linked with substance abuse: schizophrenia, schizophreniform, antisocial personality disorder, anxiety disorders, and mood disorders. Lots of these patients, well, most of these patients rather, like to self-medicate, and especially when they're feeling either anxious or they feel like they're losing control, they will then take some drugs on their own. Two major objectives of treatment for clients with substance disorders is safe removal of the chemical from their bodies. Remember that we said that we have to give them something so that they don't go through withdrawals, and we can remove the substances from their body safely. Okay, so look on page 639. You'll see there. You'll find either for alcohol, you have Librium or Ativan, and you remember you taper them off. Or for opiates, you have Suboxone, or you place them on a methadone maintenance program. Okay, but key also is to break through the denial that perpetuates the illness. There is a denial. These patients deny their use of either alcohol or drugs, and they need to face that fact that they are addicted to a drug and that they do have underlying problems, underlying conflicts which have led them to this place. All right, so the priority is to prevent those symptoms of withdrawals, the pain of withdrawals, but also to prevent seizures, to prevent delirium tremors when we're dealing with alcohol, and any alteration in blood pressure or pulse and electrolyte imbalance. So that's mostly with alcohol and or benzos, and then with opiates, not as severe, but we want to prevent those symptoms. Okay, it's not gonna. No one has really ever died from opiate withdrawals. Okay, but they get really, really sick and uncomfortable. Okay, so let's move forward. Short and long-term treatment programs. We have short-term programs like the detoxification unit at the Willows. We have short-term inpatient residential programs where the person resides there, could be there for 3 to 6 months, and they're treated. Outpatient rehabilitation programs, anywhere outpatient rehab program, and then private practice physician treatment. Okay, that's where a doctor is then handling the treatment themselves. Long-term approaches are methadone maintenance programs. Methadone is a synthetic opioid. It's long-acting, and it stabilizes itself on the mood receptor, which is the pain receptor in the brain, and it can last for 24 to 34 hours. Okay, the methadone dose. So it's long-lasting dose. Buprenorphine or Suboxone. It's a mild opiate agonist, partial agonist rather, but you don't get a lot of euphoria from it, and basically the person is just kind of, it blocks any opioid from coming in on the mood receptor. Then we also have naltrexone. It blocks the opioid receptor, and it's also used for any alcohol disorders, because it blocks the reward pathways in the alcohol disorder. All right. Let's see what else we have. Okay, and there's also disulfiram, which is antabuse, and this is used to treat patients that are alcohol abusers. So if they take the antabuse every day, if they drink, what's going to happen is their blood pressure is going to go up, their pulse is going to go up, they're going to get flush red, they're going to feel really horrible, they may even throw up. They throw up here, they're going to vomit because they drank alcohol. So You take disulfiram, these patients are not going to want to drink anything. And then I also talked about naltrexone, which blocks opiates. And then we have residential therapeutic communities, treatment, and these are programs where you would go for a year, 2 years, usually, and you would get treatment there. You have to have already gone through detox. You go to the program and you stay there for 2 years, and you get treatment. That's okay. That's basically it. The last two slides you can read on your own, and thank you very much.